Good morning. Good morning. I am Lori Whittemore, Director of Patient Access for Providence Community Health Centers. It is my pleasure to welcome you to our newest health center, PCHC Atwood, which opened 1 year ago this month. We are happy to be hosting this press conference, which is focused on the topic that is incredibly important to our patients we serve. As the state's largest health center network, Providence Community Health Center provides care for approximately 85,000 Rhode Islanders. Almost 60,000 of those rely on a Medicaid insurance product for their care. Our patients generally live in areas that are underserved when it comes to access to care. If they lose their insurance, they risk out on primary, preventative, and specialty care that keeps them healthy. Along with our partners here today, I ask all Medicaid patients in Rhode Island to check your mail in the next coming weeks for information on re-enrollment. At our health centers, we have enrollment specialists on hand who can assist patients on the re-enrollment process in person. Providence Community Health Centers will also be encouraging patients to re-enroll through flyers, posters, on-hold messaging, our websites, social media, text messages, and much more. Staying in the healthcare system is crucial to maintaining a healthy community. That is why we are so proud to be part of this effort to encourage everyone to check their Medicaid status and re-enroll if necessary. Thank you to our partners in government and the nonprofit and private sectors for your efforts to educate the public on this important initiative. With that, I would like to introduce our next speaker, Rhode Island Governor Dan McKee.
Thank you. Thanks, Lori. Well, thanks, Lori, and good morning, everyone. Much anticipated information today. I think that it's really good to be here with everyone to talk about this very important issue about Medicaid. And so throughout COVID-19, federal public health emergency states suspended the annual Medicaid renewal process to ensure residents receiving Medicaid could maintain health coverage and access to treatment. This was essential, and I'm proud of our state's commitment to safeguarding the health of our state, and we continue to be one of the most insured states in the nation. As a result of the new federal legislation, all states must start annual eligibility renewals for all Medicaid enrollees beginning April 1st. Today, my team and our community partners want to share some key information on how the renewal process will work and what Rhode Islanders who are currently enrolled in Medicaid can expect during the renewal process. The state has been preparing for this effort across Executive Office of Health and Human Services, Department of Health Services, Health Source Rhode Island, and it's a true team effort that we know that it's a large task, and we want to make sure that we're doing it as efficiently as possible. Central to all this work is our community partners and managed care organizations who help us reach residents and make this process as convenient as possible. I want to thank them for being on the team to help us get this important job done. I'd also like to thank the members of our General Assembly who are here with us today. I think it's going to take all of our leadership to make sure that everything is done possible to make sure that we're communicating with as many people as directly as we can. I'd also want to thank the media for being here today to share this very important public information. The state has 12 months to complete this process for more than 350,000 Rhode Islanders currently enrolled in Medicaid. Renewals will be staggered throughout the next year to help ensure a smoother process, and we are working to renew as many people as possible without needing additional documentation. This is a top priority for our state and our administration over the next year. We'll be taking many of the lessons we learned from COVID-19 when it comes to outreach, communication, partnerships with the community, and meeting people where they live. You can find all of our resources on a new website, staycovered.ri.gov. staycovered.ri.gov. Ensuring this process goes as smoothly as possible is reflective of our administration's three key priorities: our state's economy, our community's vitality, and our people's health. I want to thank you again to our community partners who are here and doing that important work every day. We're not going to get it done smoothly and making sure that people who are entitled to be covered will be continually covered. And I also say too, as we're going through this process, this communication is going to be the most important factor in making sure that people have the information they need and that we are able to do the work that needs to be done during this re-enrollment process. So I want to thank you. Next up, I'd like to welcome Lieutenant Governor Matos to share a few words, and then we'll hand this over to Director Brito, Director Souza, Director Lang, to walk you through the process that will begin on April 1st. Lieutenant Governor.
Thank you, Governor. Good morning. So, you know, I can't help myself. I have to say welcome to Olneyville, right? So welcome to Olneyville. I want to thank all of you for taking the time to come here to get this message across. I want to thank the community partners that are here today. Through the COVID-19, we have to make sure that everyone was getting the services of Medicaid. And now we are at a point in which we have to do the recertification and ensure that whoever is receiving the Medicaid services qualify for it. It's going to be a big task. And I want to thank the community partners that are here that have been doing this work and they're going to be collaborating with us. I also want to thank the members of the General Assembly, Representative Grace Diaz and Senator Chicon, who I saw here, two strong leaders in our community that are going to be partnering with us to get the message across. By providing the access to Medicaid, we were able to save lives during the pandemic. And together, if we work as a team, we can make sure that we can get the recertification done and ensure that whoever is qualifies to get cover continue to have their cover. I want to make sure that you know that this is going to require teamwork and it's going to require for us to access every individual. And it has to be done person by person. And you have to take it upon yourself to reach out to your neighbors and let them know how important it is. We have to make sure that, that the state of Rhode Island has the correct contact information. It's well known that in communities like this community where we are right now, people move often and we may not have the latest information. So I want to ask each one of you to help us contacting your friends and neighbors and letting them know that they need to reach out to the state of Rhode Island. They need to go to their website, which is staycoveredri.gov. medicaid.gov to ensure that we have the correct information. It's very important. If we cannot contact these individuals, they may lose their benefit, and we have to make sure that people are covered. I want to make sure that I say this in Spanish because I saw Reynaldo. You know Reynaldo's going to ask for it, right? So I want to make sure to send the message. Lo que estamos haciendo hoy es que estamos diciéndole a la comunidad que tienen que hacer la recertificación para continuar los servicios de Medicaid. El servicio de Medicaid se le dio a toda la comunidad durante la pandemia porque era muy importante asegurarnos que todo el mundo tuviera estos servicios. Estos servicios ayudaron a salvar las vidas. Ahora que ya estamos al final de este proceso de la emergencia de la pandemia, tenemos que hacer la recertificación. Y nosotros muchas veces el Estado no tiene el contacto de cómo comunicarse con ustedes. Si alguien se mudó, no tenemos ese contacto. Así que necesitamos que ustedes vayan a la página de internet que se llama state.ri.gov y nosotros vamos a asegurarnos de poner esta información en nuestra página de internet y también en social media. Vayan ahí y asegúrese de que el Estado de Rhode Island tenga el contacto correcto para usted y ayúdenos. Déjenle saber a sus vecinos, a sus amistades, que necesitan hacer esta recertificación. Juntos nosotros vamos a poder mantener a todos cubiertos y protegidos. So finally, I want to say all together, we can make sure that we can keep everyone covered. Thank you so much, and with that, I'm going to turn it over to the DHS Director, Kimberly Brito. Director?
Thank you. Thank you. Good morning, all. I am Kim Brito. I am the state's acting director of the Department of Human Services. Thank you all for being here today. I want to recognize Governor McKee, Lieutenant Governor Matos, my fellow directors, our community partners, managed care organizations, our gracious hosts here at the Providence Community Health Center. So I also want to extend well wishes from Acting EOHHS Secretary Anna Novice. She regrets not being here this morning, but she has been very much involved in this work and will continue to be straight through to the end. So before COVID-19 pandemic, Medicaid eligibility was renewed once a year. The process is called renewals or redetermination. Throughout the pandemic, this process was paused to ensure that no one lost health coverage. So as we resume this process, we know that we're going to have people who need reminders about the requirements and that we will have some first-time enrollees who are going to need our support. So this work will begin on April 1st and it will continue for 12 months. There will be approximately 150,000 people who will be renewed passively. What that means is that the state has all of the information that we need on file and that they can be reviewed without any further action. This leaves about 150,000 remaining individuals to renew actively, and to do so, they are going to need to provide some additional information for us to update their accounts and to determine eligibility. So this leads me to the notification process. So essentially, the state has developed a series of letters and notices that go out at certain times to specific populations. This is to keep them informed and, of course, apprised of where they might be in their renewal process. So I'm going to give you a quick overview of those notices. Letter 1, we have done some advance notice to our community partners. We've posted this letter on the EOHHS website, and we have already sent most of the Medicaid households this letter informing them about what they can do now, how to protect their information, and explaining the process of renewals. So it's that general overview that has been sent out to the Medicaid recipients population. Notice 2 is going to be on a green notice that goes out to 4 specific population benefit groups. This notice is a little different. It's going to indicate that what they will have to do, which is a little slightly different process, and it'll include separate instructions that was in letter 1. So notice 3 is going to be yellow. There's going to be 2 versions of that notice. It's going to indicate whether they are being passively renewed, as a member, or if the state needs additional information that they will need to return to us within 60 days timeframe for us in order to us to process the information timely. Notice 4, for those who receive the notice for a full active renewal, they're going to receive a reminder notice if we haven't received their information within a certain period of time prior to their due date. Notice 5, households receive this information when the state has received the information that we requested, giving that confidence that we have received what was sent in and that a decision is pending. Notice 6 is our last notice. It's our benefit decision notice. This informs individuals if they have either been approved or denied. Within that denial letter, there's going to be additional information for health coverage, which will include information on HSRI's auto enrollment program and how to purchase coverage. So this is a very high-level overview of the process condensed for our time here today. The most important action that you've been hearing will be consistent throughout this morning, is that what we can do now is to encourage Medicaid recipients to update their contact information. And they can do that in various ways. It's through mailing contact information, their mailing address, their email address, or their phone numbers. That can be done and updated in some convenient ways. One is that they can contact their managed health organizations, which is our Neighborhood Health Plan of Rhode Island, Tufts Health Public Plan, or United Health Community Plan, to provide updated address information. They can go online to access their accounts at healthyroad.ri, or they can also go through their mobile application if they've downloaded that, where they can easily check their scheduled renewal dates. That will become significant as we roll into this process. So we mentioned already, but Rhode Islanders can log into our statecover.ri.gov, which is the new state's website, which launched today. It is our one-stop resource, which information will be centralized, it'll guide, it'll provide support for those that are looking for more information. Rhode Islanders can call Health Source RI. That phone number is 1-855-840-4774. They can call the Department of Human Services. Our phone number is 1-855-697-4347. Rhode Islanders can also come in person to DHS offices that are located statewide. And once again, I just want to thank everyone for your support in this initiative as we move it forward. And I'm going to introduce Kristen Souza to share a little bit more. She's our Medicaid Director for the state.
Thank you, Director Brito. Good morning, and thank you so much for joining us today. I want to take an opportunity to thank the Governor and the Lieutenant Governor and Director Brito, who have done an exceptional job outlining our plans for Medicaid renewals over the next year. So I am going to focus on ways the state is engaging our community partners to inform and offer support to as many Rhode Island Medicaid recipients as possible. We currently are hosting monthly community advocate forums so our partners can stay up to date on the latest news about Medicaid renewals. Members of our team have presented about the Medicaid renewal process to many community groups, committees, and at local events, and will continue to do so in the weeks ahead. As mentioned earlier, on our website, staycovered.ri.gov, partners can find printable materials such as posters, flyers, social media toolkits, and wrap cards to share with recipients and post in their communities. And we have issued an application for mini grants available to community partners to reach the broadest group of Rhode Islanders, with special attention paid to those most at risk in the renewal process, whether through barriers to awareness or struggles to complete the process fully and appropriately. As you know, over 1/3 of Rhode Islanders are currently enrolled in Medicaid. We must utilize as many connections as possible to ensure that recipients update their contact information and complete their renewal packet when it is time for them to do so. I want to also take this opportunity to thank all of our MCOs who are here today with us: Neighborhood Health, United Healthcare, and Tufts. Our MCOs serve approximately 90% of our state's Medicaid recipients and have been incredible partners as we begin this process to restart new renewals. Thank you. Next, I have the honor of introducing one of our community partners and a current Medicaid recipient to say a few words. First to speak will be Elena Nicolella, President and CEO of the Rhode Island Health Center Association and a former Medicaid director herself. Thank you, Elena, for being with us today. Our state's community health centers, like our host today, fill such a critical role in the healthcare needs for so many of the individuals and families we serve, and we greatly appreciate your partnership. After Elena speaks, Ms. Brenda Taylor, a Medicaid recipient who receives health care through one of our managed care organizations. She will share her personal experience and talk about the importance of ensuring that as many Rhode Islanders as possible remain covered. Thank you so much for being with us, Ms. Taylor. Now I will hand it off to Elena.
Good morning. Thank you so much for your interest and for being here in this very, very important initiative. At one of the very first meetings that I attended on this effort, the state sent a very clear message that the primary goal, their primary goal in doing this, was to ensure that as many people as possible maintained insurance coverage. The significance of that message was not lost on me. It means that the state is not interested in clearing the Medicaid rules, but the state is interested in keeping our uninsured rate as low as possible, ensuring the people who are appropriately eligible for Medicaid maintain that coverage, and for those who are no longer eligible, transition to appropriate coverage. This is a really laudable goal, and we shouldn't accept that as given. Not every state is pursuing that approach. We at the Rhode Island Health Center Association and representing the community health centers are very happy and proud to be partnering with the state in this effort. So the 8 community health centers that I represent, Blackstone Valley Community Health Care, Providence Community Health Center, where you are today, Thunder Mist, CCAP, EBCAP, Tri-County, Well One, and Wood River Health. We have been actively engaged in this effort, and we will continue to be actively engaged. We'll help in any way we can. That includes spreading the message that people have to update their contact information. We're ready to help one-on-one with people to assist in their renewal applications. And lastly, we are here to serve as the safety net for primary health care services, meaning we will provide services to anyone who comes to our doors, regardless of your insurance status or your ability to pay. So we do recognize this will not be an easy process. We acknowledge the very deliberate and thoughtful approach the McKee administration has taken, and we are very ready to help. It is my great pleasure now to introduce, as Kristen Souza introduced her, Brenda Taylor, who is eligible, as Kristen said, for Medicaid and Medicare services. Thank you very much.
Thank you. Thank you. Thank you, Governor, for having me to come here today. Whoops.
That's all right, that's it.
Okay, hon.
Okay.
I am a proud mom, a grandmother, and a great-grandmother, so this is no young bird here. A few years ago, I was injured on the job. I worked at a medical center. I was, sadly to say, attacked by a patient, and I could no longer work to support myself. Being a woman, I was just trying to live and take care of my family, which I had 3 children. I had one child that was in college, and I found myself unable to help him. But right now, I'm going to say, just being a woman trying to live, and Medicaid now and Medicare helps me, especially with the costs of rising foods, cost of living. Everything seems to have gone up and gotten quite expensive. I have people in my family that struggle to find affordable housing, and it also puts a crisis on the entire family, because then we have people trying to, I guess it's called surf couching or couch surfing. But my Medicaid through United Health helps provide with food, transportation, and great health coverage. I also have a CNA that comes to help me because I have very bad osteoarthritis, and walking has been sometimes a great problem. Also, a year and a half ago, I was diagnosed with breast cancer. Because of my coverage, I was able to get treatment, and I'm here today. And I hope to see my grandchildren, my great-grandchildren, and those that are to come. I was asked to come here today to share my story because I am just one of more than 300,000 Rhode Islanders, more than 1/3 of the state, who are on Medicaid, Medicare. And like our governor and the speakers before me have said, we need to make sure that everyone is eligible to stay on Medicaid and Medicare and stay covered. So I'm asking everyone to open your mail, sign up for the texts, and update your contacts, if possible, and soon. Let's stay covered, Rhode Island. Thank you all. Now I'd like to introduce Director Lang.
Good morning, everyone. My name is Lindsay Lang. I'm the director of Health Source RI, which is our state-based marketplace in Rhode Island. I'd like to echo thanks to the governor, the lieutenant governor for their leadership on this topic, my colleagues at EOHHS and DHS for their leadership, and to our legislative and municipal leaders who are also going to play a critical role in ensuring our mutual success. We cannot do this alone. We, as an interagency collaborative, have been planning for this transition for quite some time now, but it is really heartening to see that in Rhode Island, in particular, unlike some of our other states, we are able to reach so many people with an event like this and get this important message out. Health Source RI is really happy to be poised in a position to help ensure that as many Rhode Islanders stay connected to health coverage throughout this transition once Medicaid renewals begin again this spring. Much as my role here today is to close us out and move on to questions, so too is our role at Health Source RI to sort of take the baton once Medicaid has ended and somebody is looking for alternative coverage. We've seen that over the past few years, more than ever, how vital it is to have health coverage when you need it, when you're a woman trying to live, when you're supporting family members, and oftentimes supporting your community too. Having health coverage is a basic need, and we want to make sure that people don't lose that connection to coverage during their transition. We know this is hard. This is not going to be easy for everyone. People's lives are busy, and health coverage can be complicated. And that's why Health Source RI was created. We're here to make this process easier. We want people to know that we are a source for quality, low-cost health insurance, and that we can help you navigate this pathway along the way. Some people, to that end, we've tailored some particular assistance, and I want to talk to you about that this morning. Some people who are coming off of Medicaid will be automatically enrolled in a plan through Health Source RI. We will also cover 2 months of premium to make this transition as easy as possible. Specifically, households with incomes up to double the federal poverty level, FPL, which is about $55,000 a year for a household of 4, or about $27,000 for an individual, will be automatically enrolled in that plan and give them seamless coverage. Day one that they don't have Medicaid, they will have QHP, or health coverage, through HealthSource RI. With a proposal from Governor McKee and the funding support of the legislature, those earning up to $69,000 for a family of 4, or about $34,000 for an individual, will have their first 2 months premium paid and allow them to adapt coverage through HealthSource RI and prepare to budget for that cost on a monthly basis going forward. This premium assistance will also apply to dental coverage if that's something that you are interested in having. We know this is going to be a time of transition for many Rhode Islanders, but with the tax credits that are available to bring down your monthly cost of coverage that are historically available under the Affordable Care Act, and higher than ever through 2025 thanks to federal action, we're looking forward to helping customers find a plan that fits their budgets and suits their needs. In fact, 6 out of 7 HealthSource RI customers benefit from that federal financial assistance every day, and more than 30% of our customers pay less than $20 a month for their coverage. Over the last decade or so, so many people in this room have played a role in a pretty incredible milestone for the state of Rhode Island. We have dipped below 3% uninsured rate in this state for the first time ever. That puts us very near the top nationally for our rate of uninsured. And we want to make sure that we keep as many people connected to coverage and don't recede from that incredible milestone. So HealthSource RI is here to help during this transition. We can help you compare your options. For those I mentioned, you'll be automatically enrolled in a plan on day 1. There will be 2 months of premium coverage to help you adjust to being in commercial coverage through HealthSource RI. And we urge you to go to the website, call us for help, reach out to a navigator in the community. We're here to help. Thank you all so much for being here to help carry these important messages out to our communities. That's what we have prepared for you today, and we'll be happy to take questions.
Question? If you could reiterate the percentage of Rhode Islanders that are on Medicare and Medicaid, and where does that stand relative to the rest of the nation? Where do we stand among states in terms of percentage of coverage?
Currently, we are about approximately 1/3 of the population is covered by Medicaid, not Medicare. There are Medicare recipients that also have Medicaid. They're included in that number, in that percentage. I don't have the federal national numbers, but we can certainly follow up with that.
Do you have to re-enroll?
Yes.
Why?
You have to re-enroll. You have to go through a redetermination process. That's federal regulation and law in order for you to maintain your coverage. That was in place 3 years ago prior to COVID, paused to ensure health access through the pandemic, and now the federal government has stated that we have to restart that process.
And you could get to the 6th notice before you might find you're rejected, right?
So no, not everyone will get every notice. So there's the first notice or letter that is going out now as we speak just tells folks about what we told you today. Then there are notices for particular populations that have to take a particular action or don't have to take a particular action. And then depending how they take those actions or don't determines whether or not they will receive the remaining notices.
Alexa?
Governor, I'd like to ask you, we're estimating that about 25,000 to 30,000 people in Rhode Island on Medicaid will lose their insurance or they won't become eligible anymore. Are you concerned at all during this transition over the next year on what Rhode Islanders could face? I mean, I know that HealthSource RI is definitely a solution, but until then, there's...
Yeah, I think Director Lang pointed out that we're, anticipating that, a number that in that range or more will be not eligible any longer, and they'll be transitioning into HealthSource Rhode Island in a way that will be seamless. So I think that that's important. I would say that, this whole process is concerning, but not any more concerning than when I said that we would get 90% of the states vaccinated during the COVID, right? And there was a lot of people saying, I don't think you can do that. Well, we are number 1 in the country in terms of vaccinations during a time when it was most important. this is the next task. So we have been in meetings for months on this issue, and with the same expectation that we will be leading the country relative to the recertification process.
Just to follow up on that, for the vaccine rollout, we did receive some support from the federal government as well. Obviously, this is a federal mandate. It's not a rule coming from Rhode Island specifically, but do you feel as though you've been supported by the federal government?
Yes, I think we have, and we've been in contact with the officials that are really in charge of the putting together this task. So this is a federal, a state, and as it was mentioned by Ms. Lang, that's a local effort, well, in partnership with our providers.
Ray has a question for the Lieutenant Governor. La misma información en español.
Van a haber más de 25,000 personas que pueden perder su cobertura si no hacen la recertificación. La directora de Health Source RI, Lang, nos dijo que vamos a transferir esas personas automáticamente al servicio de Health Source RI. Y se le va a cubrir los gastos por 2 meses para asegurarnos que eso le ayude a ellos a transicionar a un seguro que es pago y les ayude a crear un presupuesto y contar con ese pago en su presupuesto.
And then Alex, we got our last question, but our directors will stick around if there's any other follow-up. Alex?
So this process you're saying will take 12 months. Do you really expect it to take that long? Is there hope it wraps up sooner than that? And if you're in one of the last groups that hears back, what, I guess, are you being informed the entire time that, there's still waiting to get a decision back on the renewal?
Right. So yes, we expect it to take the entire 12 months. The federal requirements do not permit us to do more than a certain amount per month so that it's manageable. And then post those 12 months, the redetermining process will just happen on a normal course of business. So we don't anticipate finishing sooner. And I'm sorry, what was the other question?
If you are in one of the last groups that hears back, you're being informed, hey, we're still, trying to make a decision. Don't worry, we didn't forget about you, right?
Right. So the letter 1 that went out, and it is in the process of going out this week, does describe that process, and it also indicates to beneficiaries not to worry if they don't receive their yellow notification, that it is over 12 months. There's also options for them to go on the portal or into the mobile app where they can see their date of recertification so that they have an idea of when they should be expecting that mail.
Chris, do you want to mention when the families with kids are going to actually?
Sure. Yeah, so one thing that wasn't mentioned throughout the comments is that our children and families will be held until the end of this year, 2023, December, is when their notifications will begin, and they will spread across the January, February, and March. And that is due to continuous coverage for children, which goes into effect January 1st of 2024. So that message is really important to get out, that children and families, or families with children, will be held until the end of this calendar year.
Thank you, everybody, for coming. Our directors are going to stick around if you have any follow-up questions, so we really appreciate your time today.
All right.